But if I stop using it, I might lose that ability. So if I start using one of those chairs, maybe
I had a 93-year-old client I saw just a few days ago. She said, I don't have one of them, then I feel really old. She was 93.
Wow, yeah. So what parts of your pelvis can you feel, can you locate with your hands?
The top, crest.
The crest. So these are names that you'll use a lot. So in some ways there are some names that it helps to learn now. So maybe you could write these names on the board, Ruth. Oh, there she is, there. This big rim at the back is part of the pelvis that you can sense, the wing, and it's called the iliac crest because it's the bone is the ilium, and this is the crest of the ilium, which is shortened to the iliac crest. So just feel these on yourself.
There's a lot of muscle just in there.
Can be a lot of muscle. So there's usually ligament. So if you keep going backwards and towards your midline, a little bit downwards, you may feel a kind of a lip or a bumpy area here. And that's where the iliac crest meets the sacrum, and the sacroiliac joint is underneath that. But this bump that you can feel more or less clearly on different people is called the PCIS. Posterior, I like AKAs, posterior superior, because it's above, iliac spine. That you don't need to, PCIS, PSIS is the way it's commonly, can you see? It's so any part of a bony anatomical piece that's shaped like a ridge can be called the spine. So we have this, yeah.
Spine.
Oh, the skeleton's wonderful. That we've got the spine of the scapula. It's this ridge that sticks out like a shape, and that's the spine of the scapula. I just can't compete, please. I appreciate the enthusiasm and the excitement. Did you have a question that you wanted?
Really dumb, so I'm not asking.
No.
No, do it. No, it's a good question.
What's the difference between the pelvis and the hip?
Very good question. Not silly at all. And it's one that when you start teaching classes, really important. Because there's colloquialism. So most people say put their hands on their hips, and where would you put them? In actual fact, it's the top rim of the pelvis, and it's the iliac crest. And there's a confusion because many people think this is their hip joint. Up here, they think this is the hip joint. But the hip joint, so that's where people put their hands on their hips, usually, and that's where the misnomer leads from. The hip joint is down here, where the leg joins the pelvis.
So when my uncle had his hip replacement.
Yep, it was here.
Yeah, that whole thing.
Yeah, depends. There's many different ways of doing them.
Putting their hands on their hips.
Well, even there, it's not where your hip joint is.
No.
So if you, you can, teacher Margaret, would you like to come and help? Sorry. Prone, when someone's lying on their stomach, occasionally you can feel the back of the hip joint. But it's deep and there's huge muscles around it. So it's very difficult to feel. On the front, there's big ligaments and big muscles that overlie this area. So we get clues about where it is by guiding and listening to the movement of other places that are connected to there, is how we would usually do it. You'll feel a ligament. There's a ligament that goes over here. Very difficult to feel your... Yes, yes, very sensitive area. Often it can be a ticklish area too for some people.
Could you just clarify where the iliosacral joint is?
Sacroiliac joint. Okay. So if we look at the back of the pelvis, this is the one bone, this is the sacrum, this is the ilium, this is the sacrum. If you turn that around, you see the front of the sacrum, the inside of the ilium, and the line there, which is the front of the sacroiliac joint. If you go sideways, the sacroiliac joint, the movement is commonly, it's another name. So it has a little bit of gliding, sliding and rotating. So it can do this or this. Tiny movement. It's not something commonly that people sense here, but you can sense the influence of it through what's happening to the sit bones, the distance between the sit bones changes with that rotation, with that movement in the sacroiliac joint.
Is that what allows delivery of babies?
It doesn't necessarily allow it, but with the change in hormones, you get a loosening, so it increases the amount of movement there. So that, combined with the movement at the pubic symphysis, possibility of separation, increases the dimension of the pelvic canal for women when they're in labour. Okay, where were we? Pelvis. What can we feel? Hips? Yes? It's really important, because I would say the number of times I forget to ask people where they think their hip joint is. And then several lessons later, something comes up, and I think they think their hip joint is here. And it's totally influenced how they perceive the lesson and what possibilities are. So it's really important in ATM classes to clarify that early, and in lessons. It's one of the simplest things, and it's so important. You going to say something?
Isn't the hip just more... when you ask me where is my hip, isn't that more a general thing, that's all my hip here, with the muscle and everything, not particularly the joint?
So hip comes from a relation to the hip joint. And we talk about this as being the hip. It's not the hip. It's a region. It's not even the region of the hip.
No, I mean the region, or in German it's hip is more a general term. Of the whole side.
So I guess that'd be like saying the rump. You know the rump of an animal? This is the rump. But we don't have something like a word that means a region, do we? Anyone? Nah. Baby on the hip, yeah. It's another way where it's used.
It's a layman's term still.
But it's fascinating that in Japanese, in Israeli, in German, some of the words describe the region very differently. So in German...
I speak German too, so we got the same definition as actually in English, but as a layman's term, you just use a general, like the rump.
Oh, okay. But I do know that the word for thorax is more like a basket in German, is my understanding. The word for thorax? We say rib cage, which has got a more solid, often, interpretation, maybe not. But there's this
it's a basket,
basket in German, and it's just got, for me, the image of pliability is totally different. So yeah, layman's, but this is truly the hip joint. And there's, be interesting to look up where that began. What's the history of the hands on the hips? Sometimes. Yeah. Okay. So you can feel the back rim. Sometimes you'll feel this bump here, which posterior part of the iliac crest. If you come around the front, you can feel this little prominence here, front of your pelvis. That's the ASIS, ASIS, PSIS, ASIS. Anterior, front of the body. Superior, because it's upper. Yep. Iliac, because it's that bone. And spine, because it's ridged like a spine. Yes, Yona?
So then hip flexors, I assume, and connect in through there into that hip.
So,
Because they are, you say you're touching.
the hip flexors, and that muscle that book got the muscles in it, Jenny, the book of the human body, so you can have a look. But one of the flexors of the hips comes off here. The other runs from about here, along the spine, inside of the pelvis, over the ligament, to this bump here. That's what we're talking about, iliopsoas. I love my skeletons. Never have too many skeletons. So you can see, where's a name tag? Can we have someone's name? Can I have someone's name tag? I've got one, thank you. So if we go like this, so if that gets shorter, which I can't do, you can see it's going to pull, they're not elastic, the leg in that direction. And it's very powerful because it's close to the joint. It's got a strong lever, strong mechanical position. Let me show that again, Jenny. Yeah. It also attaches to the inside of the iliac crest. So both ends are shortening, and it's going to draw the leg upwards.
It's beautifully positioned, like mechanically.
Yeah.
Does it just bring it into flexion only, or?
Oh, it's a whole synergistic. We can choose what direction in space we move it in. So, rarely in life is a movement pure, so to speak, in terms of an isolated muscle direction. It's usually in an action, and then there's multiple synergistic action from other muscle groups that help direct, stabilize. Otherwise, I move my arm there and I'm going to fall over. So to move my arm outward, I need to stabilize so that it doesn't take my body weight over there and I fall, and as well as the minor directions in space.
But what is the main direction that muscle brings?
To close, so it's a flexor of the hip, it bends the leg, hip joint like this. Okay. So we've got, what else can you feel? You can feel your pubic bone. You can feel that.
Feel the trochanter off of the hip, I think that's part of the hip.
Yep, you can feel a greater trochanter, top of the femur. What about, sit bone?
In the middle of the butt.
Sit bone, can you feel your ischium?
Yeah.
This curve-shaped protuberance at the bottom of the pelvis. Okay. On yourself, you can probably feel your coccyx. But sometimes, again, the muscle tissue, the ligaments are so strong here, you may not. But most people, with a little time on themselves, can feel their coccyx. We don't usually go looking for people's coccyxes. Since the ethical boundaries have changed, you've got to be really careful. It's true. If you're looking for the pubic bone or if you were looking for the coccyx, I do it at times, but I'm really clear with the person, get them to use their hands. But we're not going to explore that today, or the coccyx. What you're going to do is work with one partner, each lie on their side, and explore the territory of somebody else. And what I would encourage you to do, like you've experienced when you were exploring the shoulder, and linking in with what Jenny said this morning and what some of you experienced is, the difference it makes if someone listens to you and is trying to tell you what to do is enormous. The effect on someone's nervous system, their state, their feeling of safety and trust is really different. So explore how you contour your hands, not to find it in a direct pathway necessarily, but because here there are big muscles, and sometimes just hanging out there and listening. The tonus will change in the muscles, and it'll be easier for you to sense the bony outline. You can explore which parts of your hand give you better sense. So walking around the pelvis, the rim, find the sacrum. For the sit bone, it's a bit like some of you are having these surprises this morning with your finding things out. One of the most comfortable ways for someone when you're beginning, so you're not probing around, is to have your partner put their hand over their sit bone, and then you bring your hand there, the back of your hand, and they take their hand away. Because you can imagine, I go like, where's your sit bone? Okay. And when you're on the sit bone, you can play with moving yourself in order to move the back of your hand to see what sort of shape you can feel. So rather than hand off like that, it could be like that. Sometimes people find it's good like that. Play with it. But it's play with how you organise yourself to feel comfortable. It's pretty powerful having your sit bone played with. But organising your pelvis to do the movement here will feel more comfortable for your partner. And you can ask, invite the questions. Mm-hmm.
I had trouble doing that in between the segments. I was trying to trace and just couldn't do it. Do you ever ask a client whilst you're just sitting there, like you said before, just waiting, do you ever ask them to move their pelvis to see if you can feel it?
Yes.
As opposed to prodding?
I rarely would in my practice as a practitioner, but as a beginner, learning to locate, fabulous way. Because without movement, if you have no anatomical understanding or image of your own pelvis or the pelvis, then it is difficult. But you also want to find it in stillness. As often as... So play with it. It's a good means to locate where you are. Mm-hmm. Any other questions? So you're going to have 10 minutes each. So find a partner. Lying on the side gives best access. You can do it in all we'll do it in a few other different orientations, but thank you for the question. If you really don't know where to start, ask the person to move their pelvis forwards or backwards and put your hands on and go for a ride.